ADHD, 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 what does that mean? Welcome to another mental health tip from Sun Valley Behavioral Medical Center. I'm Dr. Bernardo Ng, psychiatrist and medical director of Sun Valley Behavioral. So, we're going to talk about ADHD today. What does that mean? Well, first of all, let's go over the name. ADHD, attention deficit and hyperactivity disorder. Okay, we're going to go one by one. So attention is one of those brain functions that allows us to stay connected with our surroundings and give priority to what's most important and pay attention to that one activity, object, or objective until you finish it. Either a conversation, either reading a page of a book, or doing some fractions, or calculating some numbers, cooking, eating, any activity, okay? Attention deficit means that the person does not have enough attention. And then the other word, hyperactivity, is composed of those two words, hyper, which means too much, and activity. I think you get that one, right? Well, and then the D stands for disorder, because you could be hyperactive, you could have attention deficit, but not necessarily be a disorder. In order for it to be a disorder is that besides these two things, problems with attention and problems with a lot of activity, there have to be other things going on, like impulsivity, difficulty organizing tasks, or keeping up with the order of things to doing them right, inability to finish things without being disruptive or without interrupting or disrupting others in their activities, okay? So all of this is based on the delayed or insufficient development of a part of the brain, which is the frontal lobe, okay, the more forward part of the brain in their lateral surfaces and also on its orbital surfaces. What does that mean? Lateral, the ones on the sides, and orbital, the ones in touch with the orbits, meaning the space in the eyes right up there. And it's been proven already with brain scans known as PET scans, that stands for positron emission tomography scan, that on people with ADHD, children or adults, I'm going to be talking about adults today as well, that part of the brain does not get activated as soon as the rest of the brain gets activated. What do I mean with that? Well, when you're asleep, most of the brain is quiet. Not all of it, by the way, but that's not a topic on sleep. Okay, most of the brain is quiet. And then when you wake up and you start moving around, you walk to the bathroom to empty your bladder, or you go wash your teeth, these parts of the brain, the ones that direct the hands, the muscles, wake up, your ears wake up too as well. These parts of the brain, the frontal, lateral, and frontal orbital cortices in people with ADHD take longer to wake up. And what happens with these people? They get up and they forget what is the first thing that they're supposed to do after emptying their bladder. In kids, for example, that they're supposed to go to school, they don't find their shoes. And if they move around somewhere and see something that catches their attention, they forget about what they were doing and they get into this new action or new activity. It's very, very hard to go through the day getting behind, getting late, or doing your work in an incomplete fashion. Very annoying, very frustrating for parents who have children with these characteristics, because raising them, rearing them is more demanding than a child without ADHD. So this is very common. Unfortunately, it seems to be picking up in prevalence or in frequency. And for example, in a regular classroom with 20 kids, you're going to find 3 to 5 kids with ADHD. What is the treatment? First of all, you need to know what ADHD is about. So if you're a parent with a child that you suspect or that has been actually diagnosed with ADHD, please Google it, AI it. I don't know if they're going to say that now. AI it. Look for it with artificial intelligence. Get informed. Ask one of us if you're providing what is ADHD about? How can you better communicate and successfully work with your son or daughter? If you're a teenager with ADHD, my friend, hang on. Don't get frustrated. Don't justify all the things you do or don't do because you have ADHD. Learn about it. Learn about how you can get over it and complete your tasks, finish your homework, be on time to your classes, be on time for the ride to go to school, or show up at the parties at the right time, okay? And if you're an adult and you've been suspecting all your life that you might have ADHD, please come get checked out, okay? Because you may have ADHD. Unfortunately, just 20 or 30 years ago, this was a condition that people did not believe in, or they believed in, but they were ashamed of it. So there's a lot of stigma around this. And I want to give a few more seconds about this condition in adult women. You know that I said two basic components: attention deficit and hyperactivity. In fact, we no longer divide ADHD between ADD, ADHD, nothing like that. Everybody with diagnosis, we say, has ADHD. And if it's more inattentive, we say predominantly inattentive. And if it's more impulsive or hyperactive, we say predominantly impulsive or hyperactive. So going back to adult women, many of these people become adults without ever knowing that they had ADHD. They just keep failing in college, keep failing in their jobs, or feel that they make a lot of effort only to get an average, or feel that they need to make a lot of effort to just get a standard average result or outcome, okay? It has been described and is strongly believed that as children, girls with ADHD are not hyperactive, whereas boys are usually hyperactive, which is more disruptive and easily gets the attention of teachers, parents, neighbors, and other people that can recommend treatment, diagnosis and treatment. And girls can go on into adolescence, adulthood, they may be married, and until then, they find out that they had ADHD. Treatment, very simple. First of all, get over the fact that if you drink enough coffee, you're going to be able to stay awake and concentrate. Get over the fact that if you smoke, you're going to be able to focus better, as if smoking was so healthy. Get over the fact that smoking cannabis or getting CBD, you're going to get over this. Or drinking to decrease your hyperactivity. No, the medications that exist are specific for ADHD, approved by the FDA, have been around for over 50 years. More and more they become safer and safer, easier to use. Only one pill a day or one capsule a day takes care of it, okay? So, treatment again, get informed, get educated, get into psychotherapy to learn better habits at work or studying if you are still in school or you're an adult that went back to school, and take your medication. Oh, and of course, don't use substances, okay? Well, thank you for watching another mental health tip from Sun Valley Behavior.